I think if people knew how much this could influence the position of their baby into an optimal position for starting labor and labor progressing, really depends on what positions they can be restful in.
Also, really good practice for labor because during
Yeah.
labor, you want to continue to be active. You want to have some movement during labor so that you are giving cues to baby and baby is giving cues to you so they can do their dance out of the pelvis. Typically recommend towards the end of pregnancy, you're sitting either on your ball when you're watching TV at the night or you're side lying or you're
Today, we're joined by Dr. Kaitlyn Jacklin. She's a chiropractor here with us at Rooted, and she has a special interest in supporting women through pregnancy and postpartum, as well as infants and children. She takes a really holistic, evidence based approach to care, and we're excited to chat with her today about how chiropractic treatment can really support the pregnant body and then beyond. I
yes.
don't know if people really know how beneficial having chiropractic treatment in pregnancy can be for them. So let's enlighten them, shall
Mhm.
we?
Yes.
Welcome,
Okay.
Caitlin.
Welcome, Caitlin.
I love talking to pregnant women about movement during pregnancy.
Mm,
It's one of the reasons that I started that new class that I'm teaching, the prenatal movement and alignment for birth series,
Mm.
because I just feel like word needs to spread faster than I can do it in one-on-one patient interactions. Yes.
yeah. And it's a way to reach a bigger population if they come to the class and learn all the goodness. Yeah,
Yeah.
absolutely.
It's during pregnancy, there are so many hormonal shifts. The body starts producing the relaxin hormone, and that can have the biggest effect on its ideal location, which is the birth canal. That's where it's supposed to have an effect, but it's not exactly timely to the process of labor and delivery.
Yeah,
So it
right.
it gets produced throughout the whole series of pregnancy, which then can cause more shifting at the pelvis. And when you compound that with the weight gain during pregnancy from the blood volume doubling, placental organ being grown, a fetus growing, and all of that is concentrated in one area in the front of the abdomen. So that shifts
Hmm.
our center of gravity,
Mm.
causes extra strain on the low back and the glutes. And then we have this relaxin hormone that's allowing for more movement in the pelvis. It's like the perfect storm for low back pain
Mm.
and,
Which
and
is
Absolutely.
which
pelvic girdle pain.
which is like the number one. I would say that's like the number one complaint in pregnancy. I
Is
mean, there's
that,
so
yeah,
many,
is
but
that the number one complaint
like
probably in
back pain.
pregnancy? Lower back pain.
Hmm.
Well, the whole pelvic girdle, back pain,
Mm.
pubic symphysis pain, and then later in
Hmm.
pregnancy, a lot of women also complain about rib pain because baby is squishing up into that area, that lower
Hmm.
rib cage.
Yeah.
Mhm.
There's a lot going on. And I think you like to see them early, right? Because as that belly grows, it's not going to get any lighter. So,
Yes,
it's
yes.
going to shift more things around. So, I mean, ideally, if someone wanted to start chiro, would you suggest it in the first 12 weeks or would you suggest waiting until after that time? What do you recommend or does it matter?
I often am more focused as a pain-based, like functional-based chiropractor. So if you're not having any pain in the first trimester, I don't know if it's really necessary, but definitely once you get into the second and third trimester, you start seeing a lot more of those changes. And even if you're not having aches and pains at that point, it could be beneficial or helpful just to start getting some movement through the pelvis because eventually during a vaginal delivery, the pelvis does have to move and shift. And so if it's the very first time that the pelvis has been shifting in this way, um, it can it could make labor and delivery more difficult. So if by doing chiropractic care, allowing some movement and mobilizing through the pelvis prior to that um, moment of performance for the pelvis. It's had some practice already.
Right. You're
Here's
not
your time to shine.
Exactly.
Although I would say, like a second and subsequent pregnancy, like I was like my belly shot right out, like within the first few weeks of my second
Oh,
pregnancy.
yeah.
So right there are the shifts might happen a lot sooner, second pregnancies or beyond. So, but yeah, that's
Exactly.
that's great
Yes.
advice for sure.
Yes. Every pregnancy every pregnancy and every person is different, but I do often see
Mhm.
that more commonly in like multi Paris families is that they may seem to have those like aches and pains
Mhm.
earlier because the body has memory. So
Mhm. It does.
What are some of the like I I feel like you telling us you're talking to the choir, but for who have a preconceived idea that chiropractic care is all about injury, like possible severe injury, and this idea of these big cracks and these big adjustments, how could you explain what you do for a person during an adjustment in pregnancy? Like, what does it look like? I think there's so many other pieces that people aren't aware that what chiropractors can offer for relief in care if they came to see you.
yeah, so I mean, I have I call them tools in my toolbox, lots of things to offer people. And it can be based on personal preference. So if you have seen a chiropractor before and you don't love the crack, we don't have to do that. I have lots of other things that I can share. I love to talk. I love to tell people things. So educate them and give recommendations and advice. And that can be considered a form of treatment because you're
Hmm.
making recommendations for a person. But during pregnancy, yes, there are some special considerations for using hands on techniques. For example, in a non pregnant patient, a common chiropractic adjustment for the low back or pelvis would be in a side posture position. So you're laying on your side on the table and you often will twist through the low back. During pregnancy, we want to consider the round ligament and the growing abdomen. So I often prefer to do a prone position, meaning the patient is laying on their belly. So I have these special pillows, foam pillows with a cutout in the middle, and we get you all set up and we settle you down on your front so baby's nice and supported in the foam pillow. And then we can work on the pelvis. We can access the pelvis without adding any rotation through the abdomen.
Hmm.
And the way I like to do it is I use a drop piece then at that point. So instead of a big crack, you hear a big thud, which may be just as intimidating, but it actually allows us to put less force through the pelvis because we add in the force of gravity. So
Mhm.
um, yeah, that's how I do the adjustments during pregnancy, but I've also had success just doing mobilizing, which is
Mhm.
not fast and it's more slow. Um, and yeah, we always use back and forth communication with the patient too, like about pressure and comfort.
So really using your hands to do more like soft tissue release and
Hiding.
chiropractic massage.
Yes, exactly, exactly. There's lots of different muscle techniques, muscle
Mhm.
release techniques, and stretching. And then again, the advice and exercise. My patients spend more time at home outside of my clinic than they do in my office. So, what can I give you to optimize all that time outside of here?
Mhm.
Right.
The
Yeah,
functional pieces, not just having to see you
exactly.
every day. It's very
Yes,
good.
yes.
So
Bad business model.
what are you seeing a lot of? You mentioned pubic symphysis. I don't know if people know what that is. So maybe what do you want to start there and then we can talk about maybe the other common things you're seeing?
Yeah, so pubic symphysis pain is pain under the belly, so at the front of the pelvis. The pelvis is actually made of three pieces, two main pelvic pieces, and then the base of the spine or the low back. So it's where the connection between the legs and the spine is. So it it's an important transition piece for gravity or the forces to go from one spine into two legs. So it can cause some pain or dysfunction at that transition point. And then because there's actually three joints in the pelvis, one in the front and then two in the back. So those two SI joints can cause or be related to low back pain. And then in the front, you've got that pubic symphysis pain under the belly. And that can again be caused by the weight of the belly as belly grows and puts more pressure over the pubic symphysis and challenges the pubic symphysis. Again, we have that relaxin hormone and it works on joints, and that is a joint. And so there's more mobility to that area. I mean, it can also compound with other things like we spend a lot of time sitting in the day. So then that belly is putting pressure on that pubic symphysis. So a lot of women will notice it during transition times, like going from sitting to standing. They'll feel like
Mm.
that ache or tenderness at that pubic bone. And then because we have compensatory mechanisms, so the muscles, again, are working harder to stabilize that area now because of that relaxin hormone. So we get some increased or excess strain on, oftentimes from the front, it'll happen in the adductors, so the muscles on the inner thighs and into the fronts of the thighs. So we can get some irritation or some radiating pain or stiffness into that area as well.
Is
Hmm.
that the same as lightning crotch, or is lightning crotch different? Is that what it is? Yeah.
Lightning crotch is a bit different.
It's
Lightning
lower,
crotch,
right?
yes, and it can sometimes be related to the round ligament pain as well. So, like quick, fast movements under the belly, right side and left side, we've got two round ligaments. And these round ligaments actually come off the front of the uterus, and they help to anchor the front of the uterus to the abdomen, and it helps to keep your uterus from crushing your bladder. So,
This
Important.
baby
we
does
don't.
that well enough.
Yeah, exactly. Well, you don't really notice them. That's why you don't notice them when you're not pregnant because there's nothing
Yes.
in your uterus. So they only
Right.
have to work pretty hard once that uterus gets big. And then you'll start to notice that with the like quick rotation, getting in and out of the car, getting up out of
Mm,
bed, you might get those shots, those zings of lightning crotch. But really, it's just
mhm.
a pull of that ligament.
And we have those two in the front, and there's just one in the back, right?
Yes,
I think
exactly.
people are really surprised to know there's only three anchor points the uterus has to be stable in the body.
Mhm.
And the one that's in the back is literally in the lower back, which can also, as soon as, like you said, that belly gets bigger and the center of gravity gets pulled, it's all part and parcel to those lovely
Mhm.
aches and pains of pregnancy.
Totally. Yeah. It's like the classic saying, they say, oh, that's normal in pregnancy. It's like, it's a lot of it is common, but that doesn't mean it has to be suffered through.
Normal. I know.
Hmm.
Mhm.
I think this
Mhm.
is going to be a very common theme for us in our podcast. It's common, but it
But not
doesn't have to be
normal.
accepted or normalized, right?
Yes.
Right?
We can seek out ways to improve
Mhm.
and feel better,
Mhm.
Yes.
for
Yes.
sure.
And that's what I love about working with this population too, is
Mhm.
that I think for so long it's just been brushed off. And I think there's really so much we can do to help
And
women
bring
who are
relief.
suffering. Yeah. Yeah. For relief, for sure.
Mhm. So I know sciatica is a big one. Can you maybe
Mm-hmm.
talk that through a little bit and
I also think
how that
sciatica
presents?
gets confused with
Yes,
other
that's
things.
that's what I was
Yes.
thinking. Yeah.
That's what
So
I was gonna say.
maybe
Yes.
distinguish between all those
Maybe
pieces.
maybe we'll name this. Maybe it's not sciatica episode.
Yes. Yes, sciatica is tricky because really sciatica itself means irritation of the sciatic nerve. It doesn't really tell you what's irritating it. It just says the sciatic
It's
nerve is
irritated.
irritated. Yeah.
I'm screaming.
So,
Yeah.
yeah, exactly. So it doesn't really do much for us in terms of a diagnosis and helping figure out, okay, well, what do we do about that irritation? And also, sciatica can be misdiagnosed or misnamed for other pains. So in the low back, those SI joints that I was talking about, where the spine meets the pelvis, when there's excess shifting along with that strain in the glute area, um, we can get referral pain from the SI joints that travels down the glute more so into the glute area. So just because you're having glute pain doesn't necessarily mean it's a sciatica. It could
Mhm.
be coming from those SI joints, or it could be coming from whatever is irritating the sciatic nerve.
Mhm. So true
Mm-hmm.
sciatic, I mean, is that hard to diagnose? Like, is that hard for you to diagnose? Yeah.
Yeah,
If you
it
yeah.
is. Well,
Mhm.
it's not hard to tell the difference again. Well,
Mm.
for me, I can do some testing to differentiate more truly from a sciatic nerve, but also in the symptoms, right? A sciatica nerve irritation will often um, translate all the way down the leg. So that
Mhm.
sciatic nerve goes to the back of the knee, and at the back of the knee, it splits into two main nerves that travel down to the on the outside of the ankle into the foot, the bottom of the foot. So
Mhm.
that's a key question that I ask people. How far down the leg does the pain go? If it's only going to the glute, maybe the bottom, the middle thigh, it could be from a referred pain from the SI joints or sacroiliac joints. And if it's going all the way down the leg, then it could be more of a true sciatic nerve irritation. But treatment for both of those would probably look fairly similar. Maybe just a few different recommendations in terms of posture and positioning for sciatica, again, because you're just trying to reduce the irritation on that nerve root versus the SI joint pain. We would maybe focus more on adjusting and exercises and how to support the glute strength to give you more support in the pelvis.
Mhm. And what do you want to speak to about the pregnant person who wants the easy fix and wants to just put on that belly band and think that that belly band is going to solve all of their aches and pains? When is it really warranted to use a tool like that? Where I feel like I hear someone saying, "Well, I just want to wear it to be preventative," but is that a good idea?
No, I do not recommend.
I knew what the answer was.
No.
No.
I do not recommend belly band wearing as a preventative tool. I
Mm.
definitely, and especially in the absence of physical activity. So it can
Mhm.
be a great support for women who are really struggling with low back pain or pubic symphysis pain with activity. They have to walk their dog. They have to go to
Right.
work. I
Mm.
have a lot of nurses with low back pain. They're doing the
Yeah.
12-hour shifts. They're on
Chefs,
their
yeah.
feet. Yeah. So in those isolated incidences, sometimes I do recommend a belly band if we've kind of tried all the other stuff as well. But the thing about belly bands is that if we're wearing them too tight and too often, that it can prevent baby's ability to shift around and move in the
Mhm.
pelvis. And ideally, we want babies to settle into a head down position. And when they have the ability to wiggle around, then they will often settle into that position of their own accord because they
Mhm.
know the exit strategy. So
Does it also mean you're not using the muscles? Like if you have that belly band, it's kind of compensating, and then you're not actually engaging the muscles and movement as well, like beyond baby's position?
yeah, exactly.
Mm. Mhm.
You're not asking those muscles um to do their work to help
Mhm.
support the change in the pelvis.
Mhm. Yeah. So what type of movement, I guess this is the other piece, right? Like, is chiropractic safe in pregnancy? So I think we've addressed that. Yes. But then I think there's also fear, and we have a sedentary lifestyle. So, right, like sitting all day, like you mentioned, yeah, exercise isn't safe in pregnancy was a common myth way back when and still lingers today a little bit. But
Yeah.
yeah, what do you suggest are the most helpful things to do then in pregnancy to support, if they're seeing you, but keeping themselves moving in a way that's safe, and supporting getting ready for labor as well.
Yeah, for sure. I think most movements are safe during pregnancy if you've talked to your care provider and they have agreed that it's safe for you to exercise in pregnancy, then it's likely safe for you to exercise in pregnancy. And that can look like lots of different things. It can look like some prenatal fitness classes we offer at Rooted, or that you can find some other ones. There's lots of YouTube videos of different movements, but it's really just about getting your body moving. My number one, I should buy stock in them, the yoga balls that I
Yeah.
recommend every pregnant patient to own. So like a full size yoga ball they can use to sit on, so using that for sitting, bouncing, pelvic tilts, hip circles, all that good stuff. That's and if you have a desk job, adding that to your desk routine. So if you're working from home,
Oh.
super easy to start sitting on a ball. If you work in the office, a little bit trickier. So my new strategy that I thought of recently is a balance disc. So you can buy these inflatable balance discs, and they just kind of look like, I don't know, the top of a hamburger bun. And you can easily fit that in your purse, take it into work, and just put it under your
Sit on
tush.
it?
Yeah.
Just
Um,
elevates you a little bit and you're able to have more
A little
pelvic
and you
movement.
balance.
get a little bit
Mm,
more unbalanced. Again, it lets your
mm,
pelvis twist and move a little bit more during the day because it's that static, flexed posture position
mm,
that
mhm.
has no movement to it that is gonna it yeah, it's gonna cause more irritation.
And
Whereas
sitting back on the tailbone too, right? So we do tend to have this more loungy, leaning back posture. So if they don't have access to those things, do you recommend kind of like opening up your pelvis a little bit, maybe doing being a little more forward when they
yeah,
can?
yep,
Yeah.
I
Okay.
open pelvic posture. So if I typically recommend towards the end of pregnancy, you're sitting either on your ball when you're watching TV at the night at the end of the day, or you're sideline posture, open pelvic, or your hands and knees, or using the ball. And yes, if you do need to have some back support, if you don't want to do side lying, you could
Hmm.
do edge of the couch with lots of all the pillows you have behind you so that we're not all the way crunched up behind us, but at least we've got some of that open pelvic posture.
I think if people knew how much this could influence the position of their baby into an optimal position for starting labor and labor progressing, right? This optimal fetal positioning really depends on how a pregnant person can hold and and what positions they can be restful in and even active in will
Hmm.
influence that fetal positioning.
Yes.
Hmm.
And I think it's also really good practice for labor because during
Yeah.
labor, you want to continue to be active. You want to have some movement during labor so that you are giving cues to baby and baby is giving cues to you so they can do their dance out of the pelvis because it's not
Hmm.
just
Yes.
that baby has to be in one position for birth. They actually corkscrew and rotate out of the pelvis. And so they have to
Mm.
continue to move, which means you have to continue to move. And if you haven't moved through pregnancy, then you're not going to know or want to move during labor.
Labor, for
So true.
sure. One of the benefits of having to pee so much, for me at least when I worked in an office, was that I was getting up. So it like forced me to move. So like and people are very understanding of you needing to go to the bathroom. So I would actually take advantage of that. Like, oh, gotta pee
Yes.
again. And then like, yeah. So I would encourage folks to use those cues to go to pee as ways to also like get up and move during the day too.
That's often a
Yeah.
strategy I use for patients as well. I tell them just drink more water and you'll have to
Hmm.
pee.
You have to pee and you have to get up.
You have to get up.
So what about the Webster technique? I feel like um, this kind of technique has been labeled out there as to help typically get a breech baby into a head down position. Can you talk about the difference? Well, like, is there something you really do different in one body over another if there is a breech baby that you're trying to flip?
Maybe the frequency of the
Mm,
treatments. I
Hmm.
okay.
te but no, you're right. Oftentimes it's the same treatment because
It's the
really
same treatment. Yeah.
I'm working on the pelvis. So if you are coming to me with pain during pregnancy, then I am working on the pelvis area, low back area. So I'm still doing the same technique. If you're coming to me just for wellness, I'm going to work on the pelvis because that's how baby's going to get out. So I know I'm still working on the pelvis either way. Yes, but
Hmm.
and I do find when you see patients throughout the course of their pregnancy, they have better um, outcomes for positioning,
Hmm.
and whether or not that's related is for them to decide. But
That's right.
that is
Yeah.
that is what we see. So when
Hmm.
patients come in at the final hour, we can do the best we can, but sometimes baby's too big. Sometimes um, that's just the way they like to be at that point, and
Yeah.
we
Nothing you
can
can
only
do
do
about it.
yeah,
Yeah, and
yeah,
if they wait for the discomfort to come, right, and maybe it never comes, I mean, that's a wonderful
yeah,
pregnancy, but yeah, like
yeah.
what you're suggesting is like, don't, especially in pregnancy, like that, just being able to, for you to keep that pelvis moving, right, in a way, even if you aren't experiencing all the symptoms we've talked about, it sounds like it would be equally beneficial, right? And not waiting
Exactly.
till you're 38 weeks and then you're like, oh, maybe I should start thinking
Yes.
about this.
Yes, for sure.
So, what are some of the
Mhm.
exercises you do in the class that you offer for pregnant people? I just think that this should be mandatory. Every every pregnant
Prescription.
person, as years being doulas, we can see how the sedentary lifestyle has impacted
Mhm.
women's endurance, women's comfortability around being in a nice big open squat. Like there,
Flexibility. Yeah.
oh, so many
Mhm.
things. So what are some of the moves that you do in your class and other things that you suggest for movement?
Well, we practice that nice deep squat.
Mhm.
That's one of them for sure. Um,
Perfect.
yes. And we do some ball work again because I like to, I tell them in the first class, if this is your first time on a ball, then you better not be on your second next week.
Go get
uh,
one.
Go get one. Yes. So we do some ball work and I'm always, every time we do an exercise, I like to relate it to birthing positions or
Mm.
or not birthing, yeah, labor
Mhm.
positions, I guess. Yeah.
Labor position. Yeah.
Exactly. So making note and just getting them thinking about this is a position you can try to labor in. This is another position we can use to
Mm.
labor. This is why we're working on this. We do some hands and knees work, some cat cows. Well, we have to build some of that arm
Mm.
strength to be on those hands and knees if
Mhm.
that's a position you find comfortable during labor.
Mhm.
We also, you talked about women's comfortability during labor, of course, because it is a very uncomfortable time.
Mhm.
And so one of the things we practice in our class is a wall sit. So we use our yoga balls up against the wall and we settle down into that wall sit position and we practice building up our endurance for those 1 minute wall sits. So we're
Mhm.
building our leg strength to be able to hold us in these laboring positions, but we're also building some mental endurance for that 1 minute of discomfort, those contraction length periods of discomfort.
Yeah. Yeah.
Mm. Yeah.
Which is it's huge because as our modern culture, we will avoid discomfort at all costs. And we typically have the means to do it, right?
Mhm.
Like if something is not comfortable, we will find something more comfortable in favor of, right? So I think preparation for the discomforts in labor is so valuable to
Mhm.
help with that, like you said, the mental part of it, right?
Mm.
And reminding our pregnant people that this is a bit of a physical and a mental journey that is going to be to get that baby out.
For sure.
And practicing those positions, I love that about your class. And you mentioned the arm strength. I think people like the wrist and arm strength that you might like you actually don't really know what positions you're gonna like in labor. I spent
Exactly.
like an exorbitant amount of time like over the edge of my couch. And like people spend a lot of time on their kitchen sink, right, or kitchen counter.
Counters. Yeah.
And so you actually don't know which one you're gonna like. So by having that toolkit, like you talked about, you've got lots of tools, having like you're teaching them a toolkit so that when labor does come on, they're not like, but I want, like, I thought I was going to want this. And literally you're throwing your body forward on the floor and you're on your hands and knees. Like, you're like, but I wanted to do the other one, but your body is telling you something else. So I love that. And as doulas too, we would do this, right? Like, let's practice all of them. And then you have a toolkit to go to. And then reminding and having someone to remind you to change positions is equally important. So having the
Yes.
partners or support people also know, like, and so being able to say, hey, we're going to stand up now. Hey, we're going to, right? Because all I wanted to be was on the side of my couch. And my midwives were like, come on, let's go on the toilet.
Let's
I'm
do
like,
something different.
Yes.
I just want to be here. So yeah, I love that about just what you're doing. And then you do that in your sessions too. So not just your class, right? Like you are also talking
Yes.
through that a little bit, how to properly move the pelvis. So I love that.
Yes. Yes,
Yeah.
exactly. And then it's not unfamiliar to you, right? You've practiced it
Mhm.
before. You're like, "Oh, well, okay, I
Exactly.
guess I could try this position because I know I've
Yeah.
been in it before and it was actually kind of nice." So,
It is a training, and like Kirstine, like it
Yeah.
is like a marathon. And if you're just showing up and being like,
yeah.
"Oh, I'll see what happens," yes, that there is an element element of that, like I said, right? Like you don't
Mhm.
know what position you're gonna love, but if you didn't train,
Yeah.
if you didn't practice the positions, then you might be like, oh, my wrists are sore. I've never done this before. And it all feels
Yeah.
awkward. So yeah,
Yes.
I love that.
I have heard from your patients, I have heard from you, like you as a care provider may be the sounding board for some concerns that, I'm sure your patients come to you with concerns about many different things and even just being that sounding board and being that resource offerer. So, what are some resources that you have found yourself kind of offering to people when they are concerned or troubled about something?
Yes. Well, we have great resources at the center at Rooted for sure. So if it's mental health support, we've got those resources. If it's educational support, then we've got, preparing for baby classes or comfort measure classes and, even moving into like the postpartum time, then we also have the postpartum care supports. But there's so many resources that I think that can be an important part too of preparing for baby as well. Is just getting aware of what is available to you so that
Yeah, yeah,
if you need it, you know that it's there, and then you're not stressed sort of at that time looking or looking for resources.
Hmm.
hmm hmm Do you think you've learned more about the perinatal stage working at Rooted than you may have working at another clinic?
Yeah.
It's
Oh
a
yeah, for
high
sure.
population. You know what?
Yeah,
I also tell my clients, I'm like, get your partner to go to the chiropractor too, because
Yes.
you're gonna be holding positions for a long time. Your wrists might get sore because you're gonna be hip squeezing. So like, like you equally should be seeking out care, right? Like Kaitlyn can also see you too, because you're gonna likely need some tune-ups after the birth as well. So don't forget about that partner who will equally need some body
absolutely.
support. Yeah.
Yes. And actually, I do
Awesome.
get that question. Sorry, when you said after birth, a lot of sometimes women
Mhm.
will ask me, how soon after birth can I come for treatment? And that
Yeah,
Mhm.
answer can be different for every person.
Mhm.
Keep in mind, coming to see me means you have to leave your house. So, whenever you feel comfortable doing that. But then also, it can depend on your pain or your comfort level. So, if you're having a lot of low back irritation after birth, um, oftentimes upper back starts to get sore after birth because we're doing a lot of feeding and a lot of holding, a lot of
Mhm.
carrying. If we have prolonged bed stay after labor, that can also affect some low back pain. So there's
Mhm.
lots of things that we can help with in the postpartum period as well, and that time frame can be whatever is best for the patient, but there's no limitation. There's no waiting to the 6 weeks to have treatment. It's really just whenever
no,
you're
that's right.
comfortable leaving the house. Yeah.
Mhm.
And you should also let people know that they're always welcome to bring their babies to their
Yes.
Yeah,
appointments. They do
that's
not
right.
have to wait until, there's somebody to watch, but babies
Mhm.
are always welcome.
I love meeting them on the outside.
Mhm.
It's always so special. If I've
Yeah,
worked with
that's
a
right.
woman for a long period of time, yeah, it's always so fun.
Yeah.
Mm.
Yeah. And
Mhm.
Mhm.
then hearing the birth stories and how it all unfolded. So special.
Mhm.
Yes.
Oh, well, thanks, Caitlin.
Thank
Maybe
you.
as we wrap up, what is like a stinging piece of advice for women who are pregnant and maybe dispel some of the fear, maybe? Like, what can you tell them that would help them come to you for some care?
Don't settle. Don't settle. If you're uncomfortable, if you feel um, dismissed by a care provider, even if it's another chiropractor, or if you feel like you're not being heard, then I'll listen.
Caitlin.
Oh, I love that.
And like your that trusting your body piece is so huge, right? Like if you feel something's off and people are just saying that's normal, and like yeah, casting it off to the side and making you tolerate it versus doing something about it. That is so beautiful. And that's what Rooted is about too, right? We really want people to trust their bodies because if you do that and in labor, you'll equally be able to be in tune. So I love
Yeah.
it, Caitlin.
Amazing.
Yeah.
Oh,
Thanks for
well,
joining us
thank
today,
you.
Caitlin.
Well, thank you. This is fun.